Welcome everyone again to another interactive session on career guidance. And today we are going to learn more about careers in dentistry. And to know more about that, we have Dr. Ankita Pai with us today. Ankita happens to be an alumni of Mushrifan High School. And then she went on to do her BDS and then MDS. And now she is a senior endodontist, right? And we'll know more about you throughout the career, throughout this session, and of course more about careers in dentistry. So welcome Ankita to this platform, and thanks for doing this. We can get started by knowing more about yourself. Why don't you tell about yourself and how has your journey been so far, as starting from high school till now?
So I finished my BDS in Goa Dental College, following which I did my master's at KLE Belgaum. Okay. So if I go back to maybe 10th standard, I can just say that at that point, like every other person, even I was very confused about what I want to do.
Yeah.
Maybe it is like at that point, you're not really mature enough to understand the seriousness of studying or what it is to be by yourself, independent. Okay, so initially, when I was in 10th standard, you maybe consider me even as an average student. But then, when my exams came approaching, I started understanding the seriousness of this. And this could mainly be because of my parents' support. I don't think it would be possible without them. Being honest, like my preferences to join, before I joined BDS, I always wanted to do something like law or hotel management, which my parents never really agreed upon. I come from a background where every person in my family is a doctor. So considering that, my parents also wanted me to join MBBS, but I was never really keen on joining MBBS for the fact that I don't have that liking to blood. That is one thing. And the second thing is I didn't want to really do night duties and have sleepless nights. Okay. So initially, like when I started off, maybe this was in 12th standard, even till then, I had not really decided what I want to do. Okay, even till then, it was fixed in my head that, okay, I like to cook, I want to do hotel management, I like law, and I even answered those exams actually. But then my parents never really supported those options. Okay, it was only till maybe when I was in 12th standard. So my sister she did BDS in her first attempt. Now she's a gynecologist. So in her first attempt, she did not get through MBBS. Okay, because of which she joined BDS. Okay, now when she had her NEET exam and her final the final BDS exam, the first year final BDS exam, she never really had any help. Okay, because of which I used to try to help her with the work. Okay, with whatever it is, like maybe in the first year you just learn about free clinics, you work on plaster models. Okay, so during that time, I actually started understanding that maybe I can consider this, and it is something which I like to do.
Okay.
So that's how I ended up doing BDS.
Okay. And so that got you into the field.
Yes.
Okay, great. So let us get started about knowing more in dentistry and how do you build a career and what is the scope, etc. So before that, can you in very simple terms describe to people in the audience what is dentistry about?
Okay. So if you ask anyone in the audience what a dentist job is, the common answer you'll always get is even when I do patients and maybe I go back home and there are a few people who maybe are not really aware what a dentist actually does. So the common question I get is, so how many teeth did you pull out? That is one thing which everyone has a notion about dentistry, but it is not only about pulling out teeth. There are many more things that you get to learn in dentistry. Okay, like now dentistry is basically, it has 5 years. Okay, the first 4 years you have to complete your academics. Okay, and the final year, that is the 5th year, is your internship. Now in the first 5 years, in the first 4 years,
you're talking about the dentistry course, basically the BDS, which is Bachelor of Dental and
Surgery.
Okay.
So BDS is basically Bachelor's in Dental Surgery, and it consists, okay, I went a little too fast there.
You can go ahead.
BDS is basically, it has 5 years, okay, 4 years of your studies and then 1 year of your internship, okay. Then, now if you talk about the 5 years, okay, like what you have to do in these 5 years, okay. Now, if you consider the first 3 years, you would have subjects which are same as what you learn in MBBS, okay. So you would even have a few common lectures with MBBS.
I see.
Okay. So in the first year, you have subjects like general anatomy. General anatomy is basically studying about like the basic body, like how it looks like from inside, knowing the basic structure. Okay. So if I would give you an example, it's like if you open up a toy, okay, you get to see the internal structure, the wiring, the tubing. Similar way, it is you're studying a human body. Okay. So the general anatomy mainly focuses on this. Then we also have physiology and biochemistry. Now, physiology and biochemistry just teaches you about the basic function. Okay, like what is the function of your kidney? What is the function of your liver? Okay, and biochemistry is regulating the normal functions. Okay, like what is the normal sugar count? What are normal counts that your body should have? Okay. Then we also have dental anatomy. Now, dental anatomy, here you would mainly focus on the basic structure of the tooth. Okay, like if you like basically understanding what your tooth will accept, what as into the materials, the fillings, whatever. Okay. Then is dental materials. Now, dental materials, here we learn about the different types of materials that we use in dentistry. Okay, like if you ask a person who's not in dentistry, you will just say that, okay, there's just a silver filling and there's a white filling. But in that white filling, there are many more things that you actually have to learn.
I see.
Okay. So that is about first year. Then the second year is general pathology and microbiology. Now, after you learn the basic normal in first year, you get to learn what is abnormal. Okay, what is not normal, you get to know in pathology and microbiology. Okay, and then we also learn about general and dental pharmacology. This is basically about the different medicines that we need to prescribe. Okay, and then maybe a different, maybe some reaction that happens with different medicines. All those details we learn in general pathology and general pharmacology and dental pharmacology.
Okay.
Okay. Now, at the end of the second year, okay, we also have a pre-clinics. Now, your pre-clinics is something where you study about basic dentistry, like about fillings or like other treatments in dentistry, but here you're not doing it on the patient directly. You're basically doing it on plaster models or clay models and plastic models. Okay, like they are actually tooth formed same, like every tooth has a particular form. So you get to learn all those things in like how to do a filling, say, or how to do a bridge cutting. All those things you learn in these pre-clinics. So once you clear the first and second year, and once you finish your pre-clinical examination, you go to the third year. Okay, now in the third year, you are eligible to take patients. Okay, but this is under supervision, where you learn very basics, like you learn a basic filling, how to do a basic filling, how to do like, but this, what you learned on a model would now be replicated on a patient.
Okay.
Okay, so now in third year, we also learn a few subjects which are in common with medicine, like we learn general surgery. Okay, but this is just to know what are the different pathologies or what are the different diseases that you can come across. Okay, you have to learn general surgery, you have to learn general medicine as well, and oral pathology and oral microbiology. Like I said previously, in the second year, you learn what is abnormal. Okay, so in third year, you learn what is abnormal in your mouth. Okay, now oral pathology and microbiology is that. Okay, then finally coming to the fourth year, now this mainly focuses on the different branches in dentistry. Okay, like I commonly have patients and they just tell me that, okay, when I say that I've done my master's, I always have this one question, like, doesn't one dentist treat everything?
Okay.
Okay, but it is not like that. I mean, there are many branches and which you can specialize in. Okay, so the first branch, there are totally 9 branches in dentistry. Okay, so the first branch is oral medicine and radiology. Here
All
you
branches are taught to you in BDS. You get a flavor of all these branches in the final.
yeah. So before you do your internship, you just get a brief, maybe a review of all the subjects where you learn the theory. Okay. So now in the first year we have 9 subjects. The first subject is oral medicine and radiology. Now, what is oral medicine and radiology? This basically focuses on the diagnosis of a problem. Like suppose a patient walks in with maybe dental pain or some jaw pain. Okay, so you basically diagnose why that pain is happening. Okay, like, and this diagnosis we normally do with certain tests, X-rays. Okay, so all that detailing is taught in oral medicine and radiology. The second is oral and maxillofacial surgery. Okay, so this is one thing which is like it could be right from a basic tooth removal, that is an extraction, to even management of trauma cases of the head, face and neck. Okay, so anything above your shoulders would be treated, any surgery, maybe if you had an accident or if you have any, if your jaw is forward. Okay, so all these surgeries are covered under oral and maxillofacial surgery. Okay, then would be orthodontics. Orthodontics is to do with braces. Okay, then with pediatric dentistry, that is treatment of children. Okay, so the deciduous dentition. Okay, so before you get your permanent teeth, treatment of the deciduous dentition is different as opposed to the permanent dentition. So there's actually a specialization where maybe you're taught how to deal with children, how to treat teeth, because the child tooth and the permanent tooth is not the same. Okay. Then is community dentistry. Community dentistry is basically learning about the different diseases and how to prevent it. Okay. Then is periodontology. Periodontology is to do with gums. Okay, so suppose you have, say, like a very common thing like bleeding gums. Okay, so then periodontology will help you to understand why you are having that or treat the cause of your bleeding gums. Okay. Then is prosthodontics. Prosthodontics basically deals with the replacement of missing teeth. Okay, and oral. Then there's also oral pathology and microbiology. Okay, this is a separate branch which deals to diagnose maybe something like an oral cancer. Okay, so in this we actually maybe take part of your tissue and study it. Okay, so this comes under special. There's a separate specialization. Okay, and then coming last to my specialization, that is conservative dentistry and endodontics. Okay, this is something to do with your the internal structure of your tooth. That is, each tooth has a nerve from within. Okay, so if there is any damage to the nerve, then the treatment to this is done by endodontics. And also there's a specialization in fillings. Fillings and aesthetics is done under conservative dentistry and endodontics.
I see.
Okay, so this is these are the 9 branches in dentistry. And after that, you have to complete your internship. Now, in internship, you don't have to answer any exams. I think this is one of the best years of BDS because there's no fear of maybe answering the exam, or it is quite comfortable. Okay, here you just learn how to manage a patient, like the different treatments. Like in 3rd year or 4th year, we start taking patients, but then they would be very simple treatment, like maybe a small filling or a cleaning. But then when you come to internship, you learn even maybe more complex treatment.
I see. Okay.
Yeah.
So these are the
branches and maybe an overview.
Yeah, that is great. You did a very nice job of summarizing all of them. So if you are interested in a particular field in your 4th year, if you like, say, one particular field, then you can do your master's, like a MDS in that particular field, right?
Exactly. Yes.
So I understand that BDS is a 5-year course, right?
Yeah, BDS is a 5-year course. And if you want to do your master's, then you have to do an additional 3 years.
Yeah, 3 years. Okay.
Yeah, additional 3 years. So it's a total of 8 years.
I see. So you just to step back, you mentioned like in your 1st and 2nd year in BDS, you also learn about various which are common to medicine, right? Various courses which are common to medicine. So can I say that if anyone is an aspiring MBBS doctor and he or she does not get into an MBBS seat, do you think that that choosing dentistry is a good option? Is this the closest you can get to MBBS, or
this is not a very good option actually? So basically, you should have that inclination towards a few things. Like you have to be like in dentistry also, if you're considering aesthetics in a patient, like maybe if you want to do if you want to, a patient comes with you with a broken filling or a broken tooth. Okay, you need to, it is an art that it is your art in that patient's mouth. Okay, so you also need to be a bit artistic.
I see.
Okay, it is not, yeah. So there are a lot of like lot of students who, this is one thing which is very common. Okay, even in my batch, you could say out of 50 students, you could say maybe only 5 students actually joined dentistry because they wanted to join dentistry. Okay, the others were mainly because it was that they did not get into MBBS. But this is a very, it is not something that you should consider, because eventually, if you don't like it, okay, there will be, you will get frustrated by yourself. You'll feel that this is something not what I wanted to do previously. Okay, so dentistry is not everyone's cup of tea.
Okay.
Like that is one thing that you should know. Okay, don't take dentistry just because you did not get for MBBS. Instead, you would take a year's drop and then prepare for it. Like the same thing with in my batch itself. Like if there were 50 seats, around 10 students they dropped. In first year, they answered NEET again and they got MBBS. Why waste a seat? If you can give it to, if someone else who's really interested in dentistry should have the opportunity rather than just wasting that seat.
Interesting. Yeah, this is very important to know, because as you mentioned, there are many people who choose dentistry just because they did not get an MBBS seat. And that is not, that is
not something that you would be comfortable with. That 1 year also would be very tough to go through.
Okay. So only if you are passionate about dentistry, that is when you choose to do dentistry.
Yes, exactly.
Okay. So after you get your basic undergraduate and if possible a master's degree, and that is say after a period of 8 years, right? What are some of the job roles that one can pursue after getting the degree? I know you are a practitioner, you are a senior endodontist in your own clinic, right?
Yeah, and I also go to different hospitals.
You do.
Okay, so if you do your specialization, you have that option as well.
Okay.
And it's not only hospitals. Okay, like in Goa by itself, there would be more than 200 clinics. Okay, so if you now if you consider the scope in dentistry, there are different things that you could think of. Okay, so the first thing that maybe the traditional thing was that everyone would open their clinic after BDS, open your clinic, or you take MDS. Okay, now even opening your clinic.
While mentioning all these job profiles, could you also like tell about, what is the kind of a lifestyle in each of these job roles, and also what are the monetary rewards that you can get?
Yes.
In the current.
Okay, so once you just finish your BDS, okay, it is very difficult. Okay, I mean, when you just start, you can't expect a really high salary. So after BDS, either you maybe join a dental clinic, okay, as an associate dentist, okay, but then again there the salary would be somewhere around 15,000. Okay, so if you want to grow, you cannot get 15,000 for the rest of your life. Okay, you have to study further or do something more than that. Okay, like if you have studied for 5 years, it should be fruitful. If you have spent for your dentistry course, it should be something that you should be able to make up for what you have spent in these 5 years.
Yeah.
Okay, so now the first option is where normally after BDS, maybe you join a dentist, which is not a bad option if the person is comfortable with it. Okay, and again, now it's not only 15,000. There are clinics which also offer more. This is maybe the first year when you join. Okay, it will definitely increase with time. Okay, but this is the base salary. Okay, after that, the second option is maybe you could do your master's. Now, as I spoke previously of the 9 branches in dentistry, you could do your specialization in any of these 9 branches. Now, your job role would be dependent on what you felt, what liking you developed during your BDS course. Okay, so if you have a particular say a branch that you like, you could do your master's in that. Okay, after you do your master's, you are even called, like how I go to hospitals, you could even be called to hospitals, different clinics as a specialist. Now a BDS doctor normally does like there are clinics where the BDS doctors are they do all the treatment. Okay, but then there are certain cases which maybe you could need a specialist. Okay, so this is when you come in the picture. Okay, so then a newer trend now is joining, like suppose a person after finishing their BDS, they feel that, okay, this is something which I may not like to do for the rest of my life. Okay, so then they consider doing hospital management. Okay, so after completing your BDS degree, you could also do an additional MBA degree, which will help you to do in hospital management. Okay, now the pay scale of this is also very good. Okay, it even goes up to maybe 50,000, a range of 40 to 50,000
per month. Okay.
Then there are other options like you could also be maybe after you finish your BDS, you could also have there are a lot of posts, a government job. Okay, there are different government jobs like maybe a dentist in a PHC. Okay, or even more than that is a dentist in maybe the railway or the Air Force. Okay, or the Indian Army. Okay, so you can be a dental officer, and there are a lot of like advantages with this. Okay, you get covered with your insurance, you also have a good pay. Okay, and you also get maybe a pension following your completion when you retire. Okay, but then again to get there you have to answer a few exams.
I see.
Okay, then the maybe you could also consider if maybe during your course of BDS you felt that, okay, research is something that I could consider.
Research.
Okay, yeah, research. So in order to do research, you have to do your master's in community dentistry. Okay, so then after you do that, then there are like if you India is there are many companies which actually consider like people who have done, even colleges, companies, there are different you get placements after you do your uh, like you do your masters. Okay, and then the pay scale is also quite good. Okay, this is something which not everyone considers, but if you have that liking towards it, this is something that is a very good opportunity.
Okay.
Then also you could consider, now this is a newer thing where people you can be a dental blogger. Okay, this is something very interesting. Like you actually get to learn and teach someone else. Okay, so basically you make videos or articles or maybe the newer things, or where you get you make your own YouTube channel or a channel on Instagram. Okay, where then you get paid by Google. Okay, or other sponsored, you can, like there are many sponsors which also, like depending upon, there are different companies and all which also help.
Yeah.
Okay. Then after this the main, okay, now if you want to consider something where you don't want to take the stress in a dental clinic, when you open up your dental clinic, there is a lot of stress. Like if you finish your BDS and you open your dental clinic, there is a lot of stress whether, okay, will you get these many patients a month? Even when you open up your dental clinic, there's a lot of expense that you have by yourself. Okay, like maybe your staff salary, the materials you need to procure every month. Okay, so all that stress, if you don't want to have that stress, then maybe you could consider being a lecturer or have a permanent post in some hospital. Okay, you could be a lecturer in a hospital where you get a really good pay scale, which is almost comparable to a doctor in a government hospital. Okay, where you get up to 1 to 1.5. Yeah, that is the initial starting. So as the years go by, your post gets upgraded. Okay, so it first starts at senior lecturer, then you get promoted, and then you can even be the head of the department. Okay, but that takes a lot of time.
Okay. Yeah.
And then lastly, okay, I would also want to speak about opening your dental clinic. Now, opening your dental clinic is something which is not very easy, even though it sounds like, okay, I can just open my clinic here. But to open your dental clinic, you have a lot of expenditure. Okay, right from, okay, now if you have your own space, okay, then it would not be as much. But if you don't have your own space, then first you need to consider the rent. Okay, then there are other factors like you'll have to also consider buying materials every month. And more than that, when you set up your clinic, you're setting up the clinic up, maybe you need to invest at least a minimum of 15 lakhs, considering the chair. Yeah. So the dental chair is also something which is not cheap. It is quite expensive. Then if you buy the dental chair, and now there is a lot of competition. Okay, so if you open up your dental clinic, there's so much of like there's so much of modifications which have happened over time. So if you want to get a good patient flow, even the patient looks at what equipment you have. Okay, so if you have to be, if you want to have a good patient flow, you have to have the latest.
True.
Okay, now if you want to have the latest, there's a price to it. Okay, so like if it is a dental chair, then the x-rays that you need to take, so you end up spending a minimum of 15 lakhs. This is just a minimum, okay, without the space of your dental clinic.
I see.
Okay,
Okay.
so these are all the things you could do following dentistry. Okay, but then as I mentioned all these job roles, but it's not as easy as it looks like. You have to really work hard to get to that.
I can imagine that you said if you want a really good pay scale and if you want to like settle sooner in your career, then you need to have like a minimum period of 8 years. You need to dedicate almost 8 years.
Exactly.
That is like 5 years of BDS and 3 years of MDS. And that is when you can get started. So that commitment of 8 years is very important, right?
Yes,
And only
it is very important.
and
Like
only
the more experienced you are, the more faith you could put in your patients. That's how you will have more patients coming to you.
True. So now you mentioned costs of setting up a clinic, and you said like just the technology and procuring the technology and the latest equipments is just like minimum of 15 lakhs, right?
Yes.
Can you
Yes.
also briefly talk about what are the costs of education of getting a degree in BDS and MDS, like while you are in college, maybe like in terms of like for different colleges in India or in Goa?
Yeah. So now your fee structure would basically depend upon which college you get into.
Okay.
So if you you could divide it into two. Okay, one is a government college, and the second thing is a private college. Okay. Now, if you consider a government college, if you get to a government college, you're very lucky. Okay, because you could save on a lot more. Okay, like after you when you do your BDS degree. Okay, now we have 5 years. Okay, so in total, probably you would end up spending at least a minimum of 5 to 6 lakhs. Okay, now this is only for your degree. Okay, so besides that, whenever in case in the future any of you all plan on doing dentistry, okay, you also need to keep aside a certain amount for maybe your books that you need to procure, or the different dental materials, instruments. Now, when you join a government college will not provide you with the dental instruments. That is something that you have to buy by yourself.
I see.
Okay, so when you consider this, you have to keep a certain amount aside for the expense of this as well. Okay, now if you consider a private college, okay, a private college, again, now the fees of a private college per year would range from 5 to 6 lakhs. Okay, so you end up spending at least maybe 16 lakhs if you join a private college in BDS.
I see.
Okay, that is quite a lot, and you have to really work hard to make up for that. Okay,
I see. And what about MDS? This is just for BDS that you mentioned.
Okay, yeah, this is only for BDS. Now, MDS, again, if you join a government college, then it is almost a lakh a year. Okay, this is a government college. And if you join a private college, okay, then it depends mainly on which branch you choose. Okay, but most of the clinical branches, if you have to join a private college, then the basic fee would be maybe 10 to 15 lakhs a year. Okay, so then you can consider 3 years, that would go to around 45 lakhs for your entire BDS degree. Okay, which is something, which is quite a big amount.
Yeah. So yeah, after
spending. And besides that, now if you consider a private college, definitely you would not be doing it in Goa, because GDC in Goa is the only government college. So definitely you would have to go somewhere out of Goa. So there again, when you join the hostel, okay, you have to consider additional expenses, which may range from maybe 1 to 1.5 lakh, considering the materials that you need to procure. This is per year. Okay, so it is
even after spending all this and get like having a commitment of 8 years to get your MDS and BDS, there are additional costs if you want to set up your clinic, which you said is minimum of 15 lakh on just the equipment and other setup.
Yeah, like this is on like good. If you want to set up a good clinic, okay, then it would be 15 lakhs.
Okay, I see. So not to discourage anyone in the audience, but this is a lot of cost to have
Yeah, like being a, like if you want to, when you look at it, okay, you feel, okay, I'll be a dentist, but then when you consider this, you should also think of the monetary aspect.
I see.
Okay, because this is something I wasn't aware of. Okay, and then whenever there would be maybe a few like the additional expenses. Okay, so I thought BDS would be only this much. Okay, it would only be my fees for my studies, but then beyond that, there's a lot of expense. Okay, so this is another very important factor that you should consider before you join BDS
I see. Okay.
and MDS. Yeah.
Sure. So you mentioned previously that only if you're interested in dentistry, that is when you should choose this career line, not because you did not get an MBBS seat, right?
Yes, that is the most important thing.
Yeah. What are some of the other personal attributes or inclinations? How can someone in the audience know that he or she will be good in dentistry? You also mentioned briefly that you need to be artistic.
Yeah.
Is there anything else?
Yeah, so basically, if you want to join dentistry, a few things that maybe you need to have. One is the most important thing is that you need to be a artist. You need to have an artistic. You need to have a good hand, basically.
Okay.
Okay. Then also you need to have good communication skills. Okay. Again, these communication skills, it is not that you cannot develop it over time. It does come over time. Like when I started off, I was a person who was very I would not have that confidence to speak to people or speak to maybe a new crowd. Okay, that is something that you could learn during the course too, but then you should be open about it. Okay, you should be open about speaking to people, because only once you put that confidence in a particular person, only then that patient will come back to you or refer a few more patients to you. Okay, that is one thing. Then also, if you have like maybe if you're scared of blood, okay, like how I was, that is one reason I didn't consider MBBS too. Okay, so if you're scared of blood, then you could also consider like you could consider BDS. But again, there are a few branches, like I mentioned, oral and maxillofacial surgery, where you would have to deal with blood. So then that you could probably choose during your BDS course if you are comfortable with it. Okay. Then another thing is that you need to have an interest and inclination towards good oral health and hygiene. Okay, this is something which is also important. Like if you don't care about your teeth, why would you care of someone else's teeth?
True.
Okay, so that is also important. And the most important thing is you should be patient and disciplined. Because if you're going to do 5 years of your BDS and 3 years of your MDS, a total of 8 years, you need a lot of patience.
True. I agree. These are very important points to keep in mind actually before you decide to step into that line, right?
Yes.
Yeah. So starting from standard 10, because like I think that is the majority of people in the audience, maybe standard 9 and 10. How do you prepare yourself or get started towards your BDS degree in terms of the exams to be taken, and how do you prepare for those exams?
So basically, in order to get for BDS, now previously there were exams which were different for private colleges and different for the government college. Okay, or there would be a state-wise exam. Okay, but now it is different. Okay, now you have to just answer you have to answer NEET. Okay, and then according to your NEET rank, there's a state-wise merit list which is created. Okay, like you have to first apply for it, and then in order to be maybe if you have to answer NEET, you have to have, if you're in the general category, then you need to have at least 50% in your 12th standard exam, and if you're in the maybe a reserve category, then you have to have 40% in your 12th standard exam. Okay, so after that you answer NEET. So while preparing for NEET, okay, you should the main thing is you need to get good scores in both. Okay, so now suppose you are considering a particular subject. Okay, in that subject, if you have a few topics, you also need to, maybe if you're preparing for a particular topic, okay, go through the previous question papers, see what has been asked in the theory paper, that is your 12th standard boards, and see what is also asked in the same topic in the, like for NEET, the MCQs that are asked. In that way, by the time you finish studying your entire portion, you'll at least manage covering most of it. Okay, then after maybe after you finish your boards, again you would have a gap. Okay, now there are a few tuition classes too. I would not really name anything because I don't want to really promote any. You would be aware of the different tuition classes which train you for the for NEET.
Yeah.
Okay, so after that, you also need to know that the number of seats. Okay, so the number of seats in BDS are 50. Okay, and if you are in the general category, you have only 12 seats. If you're in the reserve category, there are another 10 seats, and then there's an all India quota which takes up the remaining seat. Okay, so getting into a government college is something which is not easy at all. Okay, that is something that you really need to give your 100%. Okay, so initially when I did my BDS, there were only a total of 100 seats in MBBS and 50 seats in BDS. Again, considering the quota, the different quotas, you have to be in the first maybe 70 to get into BDS.
Okay.
Okay. So you should, if you really want something, then you should work towards it. And also, when you apply for these exams, there is also something called like you need to be, you should need to be have a domicile one of Goa. So at least 10 years of residence in Goa. Or if you are not in Goa, or you are at least for at least 5 years if you are in Goa, and your parents have a Goan origin, then you are eligible for the exam.
Okay, sure. And how do you go about choosing the colleges? Is there like a top colleges that you apply?
See, when you choose a college, the first preference is always given to a government college. Okay, so a government college would definitely have a better patient flow. Okay, a better patient flow is something which would help you to improve your skill, and this is one factor that you need to consider when you are selecting your college. This is the most important factor. Okay, there's no point having your BDS degree, and at the end of your BDS degree you are not really confident to take up patients, so you're not really sure whether you'll be able to manage a complication that you have created during your procedure. Then it does not make sense. Okay, so you need to have enough exposure to everything, like all patients possible. So always consider, whenever you're joining a college, ask, like find out what is the patient flow in that particular college. Okay, now even I wouldn't say that the patient flow is only good in a government college. It is very good in a few private colleges as well, like the top private colleges. Say you consider Manipal or you consider KLE, the patient flow is quite good there. Okay, there are many more private colleges. These are just two examples I've given, but there are a lot more private colleges that are there. Okay, now again, when you join when you join BDS, okay, you would only think, okay, there are now I want to be in Goa, but that is not the only factor that you really need to think about. Okay, like when I joined MDS, I was very determined that I want to do MDS only in Goa. Okay, I was very stubborn and determined that I want to do it only in Goa. But then my parents didn't really want me to waste a year, okay, like studying. And then again, you don't have that assurance that you will get a seat the next year. Okay, so the first year and I wanted to do my specialization in this particular branch. Okay, I was getting for other branches in Goa Dental College, but I did not want to take it because I had an inclination to this branch. Okay, so when you consider all these things, all these factors, you need to keep in mind.
Okay, I see. Interesting. So looking at the patient flow is an important factor in this.
Yes, looking at the patient flow and also about the fee structure, that is another thing that you need to consider.
Sure. Coming to a very interesting point, what about some of the misconceptions that are surrounding dentistry? You mentioned one very important point, which is if you do not get into MBBS, don't go for dentistry just because you did not get through MBBS. Because
that is one of the most common thing. Like just because you want to have doctor before your name, do not join dentistry. Because if there is something, if you are not artistic or you don't like to do a few things, maybe in a few years you yourself will develop that frustration that this is something I'm not happy with. You will not end up giving your 100%.
What are some of the misconceptions?
The other misconceptions, as I mentioned previously, is dentistry is only about plucking out teeth. That is not it. There are a lot more things that you learn in dentistry. Okay. Then also there are misconceptions like maybe if you you feel, previously there was there were colleges that used to accept donations in order to get into a college or BDS degree. So
Okay.
you first of all need, before you answer your the BDS, before you answer your need, you need to have that one thing clear in your mind, that this no longer exists. You have to work hard. There's no shortcut to that. Previously, you could pay a donation to get into a college, but that no longer exists. You have to at least qualify, need to be eligible for any, like if it's BDS, MDS, you have to be eligible. You have to finally pass the NEET exam. You have to have a particular rank to get. Even if you want to take now in BDS and MDS, again, there would be management seats as well. But then even to get for that management seat, you have to have a particular rank. Okay, so you cannot think that, okay, like my parents would pay for this. If I want to be a doctor, I've not worked hard. My parents will pay for it. In the end of it, they'll maybe pay a donation and I'll get a seat. That is not it. Okay, there's no shortcut here. You have to work hard. You have to give your 100%.
I see. That's very interesting. I think that is a very important point, which at least many of us have in mind, right? Like you can get a paid seat in a MBBS or a dentistry school.
Yes.
Okay. I think we have covered most of the aspects, and thank you, Ankita, again for sharing so much information with us. I'm sure many people in the audience would have benefited out of this. Before we end and take questions from the audience, I would like to ask you to give one piece of advice to people or students in the audience on either choosing a career or specifically to dentistry.
So my advice would be from my experience itself. Okay,
Sure,
I was not an easy child. I really maybe troubled my parents when it came to studies, and they have really been after me. My dad is a surgeon, so he would be very busy. Okay, but then one person who would be constantly after me would be my mother and my grandmother. So that was when there's a particular point when you understand the seriousness of what you want to do in your life. Okay, you can't be very casual always. Okay, at one point you need to give your 100%. You need to understand that you cannot be dependent on your parents always. You have to be by yourself at some point.
Yeah.
Okay, so work hard, give your 100%, and you will definitely get there. Okay, and be kind, be polite, be humble to your patients and to everyone else.
Thank you so much. It's very humbling. So it's time we take some questions from the audience and any comments from the audience. We have a couple of comments from the teachers saying this was very informative and a beautiful session. If there are any other questions from the audience, please feel free to write your name in the chat and I can maybe unmute yourself and ask, or you can type the question in the chat and I can read it out to Ankita and she can address it from there. In the meantime, I have one question which I think I missed, which is once you do your MDS or after you do your BDS, you spoke about different job roles that you can hold. You spoke about being into teaching, like a lecturership or having your own clinic. I also I was curious to know what is the scope abroad? Is there a chance to practice in other countries, or do you have to get answer any exams or get a degree from another country to start your practice there? And what are some of the popular?
This is a very important aspect. There are many Indian students who actually consider this. Okay, now you get a really good pay if you consider this option going abroad. Okay, but then again with a good pay, you have to also sacrifice a lot of things. Okay, like suppose you do your BDS degree in India. Okay, it is not something that could be accepted in a few countries abroad. Okay, so if you say USA, okay, now USA, if you want to work as a dentist there, okay, your degree is not valid there. Okay, so you have to answer the NBD part 1 and part 2. Okay, then you are eligible to do repeat your degree again. Okay, that you get to do a DDS is the degree that you do in USA, which is a valid degree there. Okay, your BDS degree won't be valid in USA. Okay, then the other countries like Australia. Now, Australia, you have to undergo and you have to go through an assessment process, which is in 3 stages. Okay, and after you pass those 3 stages, only then you can apply for a dentist license. Okay, then if you consider UAE, the Department of the Department of Health, you need to get a license from them by and then following this, once you get your license, then you are eligible to answer the dental practitioner exam. Okay, and there are other like in New Zealand, there are different, like every country has different exams. Okay, so you need to really understand that your BDS degree won't be something that would be valid abroad. Okay, there would be a few countries that would consider your BDS degree, but again, you would need to answer additional exams to be qualified as a dentist in their country. Okay, and then again, there are a few countries where you need to be before you do your BDS, before you do a degree there, you also need to have an additional experience, which could be being an oral hygienist. Okay, oral hygienist is something where you learn, you are more like it could be an assistant, like where you understand about the basic dental health. Okay, yeah. After you have an experience in that, only then you are eligible for the exam.
Okay.
I hope it is clear.
Yeah. I mean, if anybody's interested, they can go and learn more about applying for a license or answering specific exams. Yeah, but this gave me a good idea about
another thing. What maybe if after this session also, there are a few students who want to see the kind of work or what a life for a dentist is like. I have my clinic in Panjim. You could come in any day. I can actually show you what exactly we deal with on a daily basis, or what is the kind of what are the things we do in dentistry. If maybe it is not clear, like just being theoretical is something, and seeing the clinical aspect is also something else.
Yeah.
So if anyone is considering dentistry and wants to know more about it, feel free to contact me.
Okay. I think this was very helpful because, like knowing a particular profession or a career line is always better when you actually experience and see it by yourself rather than just listening. Listening, of course, gives you an overview. But if you go in your clinic and actually see Dr. Ankita practicing, then I think you'll get a better idea of what is a life of a dentist and what do you exactly do as a dentist, right?
Yeah.
Yeah. So thanks for the offer. I think I'm sure some of them will definitely turn up. I don't see any particular questions.
Either it was too much and they didn't understand anything, or it covered everything. It's either of it.
Yeah, I think it was very clear, and I think I had all my doubts, all my questions cleared in mind. So this was great. Yeah, so if anybody has questions later after the session ends, please feel free to write me an email, and I can get in touch with Ankita. Yeah, the comments you were very clear, so that is very positive to hear. Yeah, so as I said, you can just email me with any questions, and I can get in touch with Ankita and get back to you, or maybe directly contact Ankita and visit her clinic. Now that she has given an offer. So thank you, Ankita, once again for joining me on this platform and sharing a lot of valuable information and insights into careers in dentistry. And we wish you a good luck in your professional career.
Thank you.
Yeah. So let me end this session. Thank you so much. I'll see you again.
Yes.
Bye-bye.
Bye.
Bye.